Pain is a very prominent symptom in chronic pancreatitis, and it's present in up to 90% of the patients. In recent years, we are gaining a better understanding of the underlying pain mechanisms, and it is now evident that pain mechanisms involving the central nervous system may be of major importance. In this study, we investigate so-called descending pain modulation from the brain and brainstem and its role in chronic pancreatitis pain. Here's a little animation describing the descending pain modulation phenomena and its role in chronic pain. First, let's consider a pain signal generated, for example, in the pancreatic gland. It's transmitted to the spinal cord via the visceral afferents, and then it's transmitted to the brain and brainstem via as an interaction in the spinal cord. This is the normal afferent loop in pain processing. However, a very important secondary loop is involved, and this is called descending pain modulation. Descending pain modulation can either be facilitatory or inhibitory. Under normal circumstances, when the subjects are not suffering from chronic pain, this descending inhibition or modulation will be inhibitory, thereby dampening the upcoming signal to the brain. This is sort of a negative feedback loop. The pain inhibits pain. However, when the pain arising from the pancreatic gland becomes chronic or sustained, there may be a shift in this balance, whereby the descending modulation is shifted towards facilitation, or the inhibitory capacity is ceased, and now we can see that the descending inhibition is not so prominent and more pain is going up to the brain. So this may explain the transition of acute into chronic pain, and we hypothesized that this would be one of the mechanisms underlying chronic pain in chronic pancreatitis patients. In the laboratory, we can induce the descending inhibition or modulation by using the so-called cold pressor test. This is a very simple bedside test where we ask the patients to immerse their hand into ice-cold water. It's 2 degrees Celsius, and they should try to keep it there for as long as possible to induce this descending inhibition by this tonic pain stimulus. Now it's actually getting painful. The descending modulation induced by this cold pressor test can be quantified by applying a so-called test pain before and after we have induced the descending modulation. In this experiment, we use a pressure stimulation where we deliver a standardized pressure to the quadriceps musculature of the patient immediately before and after we induce the descending modulation. When applying this pressure stimulation, we ask the patients to press a button when they reach the pain threshold, and we then note the amount of pressure necessary to evoke pain. So let's have a look at the results. Here you can see a graph describing the pain pressure tolerance thresholds at the baseline, meaning before, immediately after induction of descending inhibition, after 2 minutes, and after 5 minutes. The solid line represents the healthy volunteers, and the dotted line represents the patients. The healthy volunteers were able to tolerate about 40% more pressure on the knee before it evoked pain after the descending inhibition was kicked in. On the contrary, the patients only tolerated about 50% more pressure on the knee after the descending inhibition was kicked in, and this difference was highly statistically significant. Also, when considering potential confounding factors such as diabetes, previous alcohol abuse, and opioid treatment, the difference between the group remained stable and there were no effect modifications from these parameters. So this finding represents a loss of descending inhibitory capacity in patients suffering from pain due to chronic pancreatitis. Furthermore, as a consequence of this loss of inhibitory capacity, we found that the patients were hypersensitive to electrical and thermal stimulation of the sigmoid, which means that they have a sort of generalized hypersensitivity of their gastrointestinal organs. So what is the clinical impact of these findings? Well, I believe we have to consider not only the pancreatic gland, but also mechanisms in the central nervous system when we are going to treat these patients for their pain problems. Thank you for your attention.